Welcome to the League of Women Voters and the Alliance for the Arts Virtual Candidates Forum. Some of the League's voter service activities include candidate forums and voter guides. This information is made available to the voting public to help in their decision-making process. The League of Women Voters is a nonpartisan organization that does not support or oppose candidates or political parties. Happy learning.
Welcome to a candidate forum presented by the League of Women Voters of Lee County in conjunction with the Alliance for the Arts. The purpose of these forums is to inform the voting public of the opinions of the candidates running for office. It's not a debate. There will be no crosstalk between the candidates. There won't be any comments from one candidate on another candidate's position. They will be given 2 minutes to open. They will be given 2 minutes to close. They will be given 1 minute to answer each question. The order of answering the questions and opening and closing is random, to be decided at the beginning of the forum itself. So sit back and enjoy. Thank you.
Hello, I'm Mary Beth Gentleman, a member of the League of Women Voters of Lee County, and welcome to this candidate forum featuring candidates running for the Lee Memorial Health System Board of Directors for District 3. All candidates running were invited to participate in today's forum. So let's get started with our 2-minute opening statements, and I will ask Dr. Cohen to begin.
It's very difficult for me to summarize in any amount of time what my career has been like or where I come from, but I'll try. I've had a very diverse career. I'm a physician, a pediatrician. I've been a bench scientist. I've had positions, volunteer positions that have varied from organizing and running an institute for disabled people to being a chair of a board of police commissioners for a large city up north. I am interested in helping people. I'm interested in organizing and working with others to achieve the goal of an efficient and effective system of providing care and looking after the welfare and well-being of my fellow persons in whatever community I reside. I have been an academic leader, a scientific leader, and have been chosen to be a leader on basically every organization to which I belong, including the board of Lee Health, where I served as chair for 3 years of the time I've been on the board. It's been an exciting time for me, and I have several issues that I would like to see brought to the fore and brought to fruition or fine-tuned before I say that I have finished with my run on this board. And so another term beginning now would be very useful to me to achieve my ultimate goals.
Thank you. And Mr. Collins.
I want to thank the League of Women Voters for the opportunity to participate in the Zoom call today. I've been very fortunate to serve as the Lee Health Board of Director for the past 8 years. I've served 6 of those years as the treasurer of the board, and I'm currently serving as the chairman of the board. I bring to this board a business and financial background and acumen. I am currently a mortgage banker here in town. I've been here since 1984, and I've been in banking for the last 36 years. I've lived here for the entire time, raised my family here. I'm very involved in the community, helping with local nonprofits, with volunteering and philanthropic activities, as well as serving on those boards. Most recently, I serve on the De La Salle Academy Finance Committee. As I reflect on the last 8 years, I'm very thankful and proud of the accomplishment under this board's leadership that have been achieved. A few of the milestones is that we provide Southwest Florida with the Golisano Children's Hospital. We've expanded the Gulf Coast Medical Center, and now the newest facility at Coconut Point in the Bonita Springs area. We've elevated our patient safety and quality system-wide, moving from leapfrog ratings of C's and D's to A's. We've expanded our community reach through enhancing population health. We've successfully transitioned through the retirement of a long-term CEO, Jim Nathan, and hired our new CEO, Larry Antonucci. As a safety net health system, Lee Health has successfully navigated the ever-changing balance of our expanding population here in town, with the reduction of commercially insured and the reduction of Medicare and Medicaid reimbursement. Over the last several years, the current board has made expanding mental and behavioral health services a priority in our community, but we still have a ways to go. Most recently, the board has led the pandemic during the system through the global pandemic, being nimble and adaptive in the face of ever-changing environment. And there's still work to do.
Thank you. All right. David Klein.
I would too like to thank you, Mary Beth, for moderating today, and the League of Women Voters for conducting this forum. My name is David Klein, and I am running for director from District 3 for the Lee Memorial System. This is a down ballot race, but a very important one. Lee Health is the backbone of our community's healthcare delivery system. It's done well, and frankly, we need it to do well. It's facing some challenges, how it handles COVID, how it manages growth, how we deal with affordability, how we respond to new competition, how we respond to the end of Certificate of Need, which effectively gave us an inpatient franchise. The board is really a very good board. I have doctors, nurses, therapists, consumers. I really can't complain about the incumbents, but there's no one on the board who's a healthcare executive who has run a healthcare business. And that's frankly who I am. I'm a healthcare executive. I was CEO for 10 years of a multi-billion-dollar healthcare delivery and insurance company. I have more than 30 years of executive experience in healthcare. I've been a corporate director of 15 not-for-profit or for-profit companies, healthcare and non-healthcare. I've been board chair or lead director of 5 of them. I've gotten to know Lee. I've been a pro bono advisor to senior management, a member of their board finance and investment committees. I'm passionate about this community. I've had a home here since 2005, 15 years. I think it's one of the best places in America to live, and I'd like to keep it that way. I have a history of giving back to my community. I have a distinguished record leading United Way, Boy Scouts, American Cancer Society. I'm a very serious candidate. If you check out my website, you'll see that I've gone to the trouble of actually writing thought pieces on what should happen. And I thank, again, the League today for asking us the questions that they are.
All right, great. So we'll turn to the first question. And I will ask David Collins to start off. In your view, what are the most important challenges now facing the system, and how do you propose to address them?
Yeah, thank you. So obviously, navigating the system through this global pandemic is a priority right now, and keeping and maintaining employment within the system is a big priority, and the financials, quite frankly. All while we have the Certificate of Need that's been lifted in the state of Florida, which basically means that there's going to be a lot of competition coming into this area for the safety net healthcare system. So really the priority is to navigate the financial challenges that are coming at us, and to be able to continue to give the best and safest care to our community.
Thank you. And Dr. Cohen.
Well, as any health organization in the country could say, we have myriad problems that need to be resolved. The competition that's already been mentioned is a key one. Being able to recruit and retain high quality practitioners is a real issue. And as there is competition for patients, there'll be competition for the services of qualified individuals to provide the service. And the expansion of our programs at Lee Health to include behavioral and psychological support programs is a major priority that will be running into problems both of funding and of personnel recruitment.
Okay, thank you. And Mr. Klein.
Yeah, I think what Dave and Sandy said are pretty much right on. Obviously, dealing with the financial issues created by the pandemic, dealing with the quality of care and access issues created by the pandemic is sort of the firefight of the day. But we are, if you look at our staffing ratios, the number of doctors that we have caring for our population versus state averages or national averages, we're short, someplace between 350 and 700 doctors. And that shows up all the time. It shows up when people ask for appointments, how long they have to wait. It shows up with consults. It frankly shows up in trying to get physician engagement because they're working so hard. We need to deal with that. Again, as I said earlier in my opening statement, we need to anticipate competition. There's access issues, certainly in Cape Coral for inpatient care, especially in season. There's access issues downtown with Lee Memorial. It's an aged plant. We need to deal with that. The behavioral health problems. There's undertreatment of both adolescents and adults. Some of that's workforce tied, and we need to deal with that.
Thank you. So we'll start. I'm going to have you start again, Mr. Klein, with this question. And some of you touched on this lightly before, but tell us how you have used your education and your experience to pursue matters of importance in the public sector and in your community.
Again, as I said, I'm a healthcare executive. My background goes all the way back to college and graduate school. I have a graduate degree in hospital administration and finance. I've led healthcare not-for-profits. It's been who I am. My not-for-profit insurance company cared for 2 million people. 140,000 patients called us doctor. I ran a hospice. I ran a home care agency, certified and licensed agency, a pharmacy, a specialty pharmacy, a durable medical equipment provider. It is what I did. Beyond that, I chaired United Way. I was United Way of New York State Leader of the Year. I've received Boy Scouts Top Volunteer Award, which is called the Distinguished Eagle Scout Award. I've chaired a capital campaign to raise money for a Hope Lodge for the American Cancer Society. My personality is one of giving back. That's what I have dedicated myself to my whole life. And frankly, this is my new community. I want to do it here.
Thank you. And Dr. Cohen.
Pleasure. Thank you, Mary Beth. I've been schooled both in the formal sense of schooling in medical school and as a sabbatical visiting faculty member in public health and leadership in academic institutions at the Harvard program. But it's been through the school of hard knocks as well. And I've learned how to deal with and participate in developing and coordinating medical staff activity and patient organization and competition between and among hospitals for the dollars necessary to provide the care in the community. I've had experience with all of those issues and feel as though all of that background is pointing toward the culmination of my term if reelected to the board at the League Health.
Thank you. And Mr. Collins.
Thanks, Mary Beth. 8 years ago, I was asked to throw my hat into the ring and volunteer to be elected to this board of directors. I was recognized by my community that I was giving to nonprofits and helping out with philanthropic efforts. And obviously I bring in a business and finance background. So when I got on the board, I was really one of the only ones that understood the financials. So this board is obviously the business acumen and the financial background. I have boards as well, and it seems like I'm always the one that gets tagged to be the treasurer of the board because of my financial background. So that's why I like to volunteer for my services.
Thank you. So we'll start with Dr. Cohen on our next question. I think there's been a lot of commentary with respect to COVID, highlighting some of the inequities in access, availability, and affordability of healthcare. How would you go about improving access, availability, and affordability in Lee County?
Well, it's an interesting question. It could be answered like so many other questions in healthcare with the simple answer: money. Money is not the answer to everything, and it's certainly not the only answer to anything. But absent money, there are real problems in providing the basic environment for healthcare distribution to be equitable. And as a safety net institution, we have had multiple experiences with the use of funds and available assets in order to serve the maximum number of people in our region as efficiently as we have done. We receive no direct support from any taxing agency, and therefore we have to do it on our own. And the efficiency that the board has overseen over the last years that I've been on the board has been remarkable, and we can reproduce that when confronted with emergencies such as we've had this year.
Okay, thank you. And Mr. Collins.
Yeah,
Question.
the COVID-19 pandemic has really brought about some serious issues in our community with regards to access, but it's also brought about a lot of opportunities. For instance, the telemedicine access, the numbers went up astronomical for folks to get their healthcare through telemedicine. And not only is that more accessible for the community, but it's also more affordable as well. Another thing, as Sandy was talking about, the board has really pushed for lookalikes to be spread throughout the community for the more less fortunate parts of the community that need access. So we've developed that over the last 5 to 6 years as well.
Thank you. And Mr. Klein.
Yeah, I mean, clearly, COVID has put an exclamation point on the question of health equity. If you look in the Hispanic community, death rates run 30-40% higher than for Caucasians. African American have similar numbers, and you can't ignore them. Those issues are not just healthcare; they're social as well. There's issues with having access to care, absolutely, but there's issues with transportation, there's issues with food deserts, there's issues with culture. In some cases, you're dealing with undocumented residents, and and you need to work with the communities, to solve the problems. My experience in other communities, other markets, that if you try to bring in a solution, you're going to get it wrong. You need to have engagement, and there are community groups that invite us to work with them. I think the success of the FQHC lookalikes speaks to the beginning of that. We need more like that. Will it take funding? Yes. And that frankly comes back in some ways to the competitive challenge issue. If we lose our profitable service lines, we're not going to have the margin needed to provide this type of subsidy, which comes back to management.
Okay, thank you very much. I'd like to start the next question with Mr. Collins. If there is a second wave, or in anticipation of potentially there being a second wave of COVID in the fall and winter, what do you think the board should be doing with respect to staffing, equipment, supplies, and policy to be prepared?
Yeah, to be clear, when this pandemic hit, the board was very engaged with administration and the C-suite with regards to getting updates on a weekly basis from the CEO, the CFO, and the chief operating officer as well. And at the beginning, none of us really knew what was going to go on. But I can tell you right now that I feel very strongly that the system is very much prepared for the second wave. I think we've learned a lot through this pandemic on how to manage the uprising in cases. If that happens again, we'll be prepared. I know that with regards to staffing and supplies, we've gone from a 7-day PPE supply all the way up now to, I think we're all the way up to 120 days now. So the supplies are being warehoused, so to speak. And I really feel confident that administration has turned the corner and is prepared for this.
Thank you. And Mr. Klein?
My impression, and I'm not on the board, so my information is a little removed, but I think management has done a very good job of, frankly, taking us through the first wave. And from what I can glean, and I sit on the Finance and Investment Committee, getting us ready for the second. They have contingency plans to staff up to 1,800 beds. They have PPE. They have ventilators. They know if they have to defer electives. They know where to go. If there are any opportunities at all, I would say they sort of exist outside of the delivery system regarding demand management. You're creating public awareness. There's been some tension regarding what should and should not be done. I give management a lot of credit for being gutty and really taking hard positions on conservative behavior. I don't think mandates in this community are going to work. There are issues regarding surveillance, testing, and tracing, and isolation. I think there may be some work that could be done there, but I would say on balance, based on what I know elsewhere in the country, I think these guys are doing a pretty good job.
Okay, thank you. And Dr. Cohen?
Well, I think the last comment that David made just now is one that should be emphasized, and that is that we have a management group as well as a management structure currently operating, which gets the maximum use and welfare out of the resources available to the institution. The preparation for the future is basically more of the same, while keeping an open mind about the fact that what we see may be different around the margins enough that there'll have to be emphasis in areas that we haven't thought much about. The adolescent, the younger child may very well become the target for care because the incidence of symptomatic disease may be higher in them in a future round than it's been in the original round. So we have to stay light on our feet while at the same time trying to oversee more of the same that's been successful.
Let's turn at this point to coordination with Lee County government. And I will start, I'll start with Dr. Cohen. In your view, Dr. Cohen, do you, what issues do you think are in need of coordination or more coordination with Lee County government, between the system and county government?
That's an interesting question because I have actually been pleasantly surprised over the years at how little conflict there is between the hospital, its administration and board, and Lee County government. I find it to be in general, a very cooperative spirit of interaction. Could things be better? There's no question that subsidy from the county to provide policing and sheriff department backup would be helpful. Obviously, we've been functioning without it, but the assistance of the sheriff's department is always welcome. But it does cost money to get involved with bringing people in from the sheriff's department. And there are myriad services that the county provides, which the hospitals could use as resources if they were made available more freely.
Thank you. And Mr. Collins?
Yeah, I would agree with Sandy. I think that this pandemic especially has brought along a lot of cooperation and coordination with the county and the healthcare system. The leadership, Dr. Antonucci, has been engaged quite regularly with the county staff with regards to the coordination of handling the pandemic and the communication of that. Also with the sheriff's department as well. I have a standing 9 o'clock appointment every Wednesday morning with Chairman of the Commission, Brian Hammond, and we have discussion, especially surrounding the latest with regards to the pandemic and how the county and how the system are handling it. I'd like to see more, but at this time, I think it's done pretty well.
Thank you. And Mr. Klein?
Yeah, thank you. It's my impression that that things work pretty well between the county commission and Lee Health. If I was to, look for opportunities, it's going to fall again in that social determinants area, housing and transportation, some of the lifestyle issues, proper diet and nutrition and exercise. There are some issues that we've seen. It's not so much with county, but with state on clean water. We saw last year some issues with red tide. It's a good relationship. Again, going back to the pandemic at the beginning, there was some tension regarding demand management, how to flatten demand. But I think given the culture of the community, we got to the right answer.
Thank you. All right, I'm going to ask Mr. Collins to start on this question. COVID-19 has stressed every governmental budget. In general terms, how would you handle a tightening, a belt tightening, if you will? Where would you look for savings? Where would you look to try to increase revenues?
Well, where we have looked is obviously in the supply chain and also into the employment of the system. The staff had come up with a very good program, in my opinion, with the volunteer exit plan with some of our staff that was either on the verge of retiring or ready to retire. And they've also been very creative with furloughs and with sabbaticals and extended vacations as well. The biggest expense of the system is employment, so they've been able to tweak that down. And to kind of put that in perspective, first couple months of COVID, the system was down about $100 million, and it's rapidly turned the corner. It's still going to show a loss, but it's turned the corner by taking on these creative ways of managing the system. There can be a lot to be done with. I'm just running out of time. Sorry.
Thank you. Mr. Klein.
The loss of revenue is tied to deferring elective care. In some cases, those deferrals were made to create capacity. In other cases, it was because of a shortage of staffing and supplies. I think the easiest way to bring back revenue, which is what has been done, is to open up electives as quickly as we can. Do that safely. I think we bump into some public issues regarding confidence in the system, that it not be a place where you become infected with COVID, and there's been good public education programs that have followed. Having pushed as hard as you can on sort of growing volume, you go back to the third-party payers and see if you can get grants or advances. That has occurred. It could occur again. Going beyond that, it's really longer-term solutions. Some of what we're doing in population health management holds promise, though it really hasn't been at this juncture hugely productive from a profitability perspective.
Well, so thank you. And Dr. Cohen.
And there's so much that could be said about this issue. Stockpiling of material in advance, the plan to move patient areas from one use to another use in short call when a problem is apparent, are all ways of cutting the cost of meeting the initial challenge of something like this pandemic. How to build back in a sensible and sensitive way, build back revenue and build back assets is a somewhat more difficult question to answer in the generalities. I think one would need to see the magnitude of the problem and to know better what solutions were put in to limit the magnitude in order to decide what to reverse in order to come back to normal operation.
A complex question indeed. And let me ask you our final question. In terms of long-term strategic planning and competitiveness, adequate staffing, doctors, nurses, other technical hospital staff, and so forth, would appear to be key. In your view, what should the system be doing to ensure that it will have adequate, high-quality staffs of doctors, nurses, and other high-tech persons delivering health services to the community? And let me start with Mr. Klein.
That is one of the most important questions, which the board should be addressing, sort of the long-range planning, strategic planning. And we're going to grow. We're growing at 3%, 4%, 2% a year of population. We're going to need more staff. We're going to need more facilities. And that comes back to, at the end of the day, workforce development and training programs. In the case of physicians, it comes back to residency programs. Conceivably, us having a stronger affiliation with a medical school. It comes back to us having more scale, more service lines, probably more sites. There's going to be some other titles, pharmacy, dentistry, some of the behavioral health specialties that we're going to need workforce development on. It has to occur. I have a paper on my website about the Southwest Regional Health System of the Future, where a lot of that is laid out. I really have thought this through. I lay out the paper not as a prescription, but frankly, to start conversation.
Thank you. And Dr. Cohen.
I guess I come at this question with an experience that others don't haven't had, and that is that I was not only a trainee, but organized and ultimately ran and was responsible for training programs for physicians and allied health personnel that were attached to the training of physicians. So I have an idea of some of the problems that are associated with this, although it's necessary to be more active in this way, that is, provide training for our own to bring them into the system. This is an area where the county could probably be very useful in helping Lee Health to create an environment and a recruitment system to bring people from all levels of health care employment into the Lee region, so that we'd be able to have more persons to choose from as we develop training programs of our own.
Okay, thank you so much. Mr. Collins.
Thanks, Mary Beth. Clearly, as this community continues to grow, we need to grow our own. And one of the things that the system has been doing for the last 6-7 years is their residency program to develop their own docs here, and we've been very successful at that. I'd like to see more of that go on. I'd like to see some more collaboration with FGCU and our other universities here in the state of Florida. And I would like to obviously ramp up the recruiting efforts, which I know right now we recruit nationwide, but I'd like to see that happen more as well. Thanks.
Thank you. And now we've come to our closing statements. I will ask Mr. Klein to start with his statement.
Again, I thank the League for doing this today. I'm very passionate about healthcare. I've devoted my whole career to it. I'm a patient-first personality. I actually go back into my high school days, and it was my favorite debate topic. I'm the son of a pharmacist. I used to help him, prepare prescriptions, deliver prescriptions. It's what I do, and in our community, Lee Health is the way you do that. I've had a phenomenal track record elsewhere in the country. I'm now full-time Florida. I've been involved with Lee as a committee member, as an advisor now for a number of years. I've been encouraged by leadership there to run for the board. I'm stepping up to that invitation, and I really would like the at-bat. I'm sure I can make a difference. You could tell through the questions posed here today that I've done my homework. I have relevant experience from other places, and I believe adding a healthcare business person, a healthcare executive to the deliberations will end up with better decisions. I'm not saying we shouldn't have caregivers and clinicians. We absolutely should, but having a blend of the two will get us to better answers. I'm energetic. I'm articulate. I'm involved, and I will be going forward. I'll bring my record from elsewhere to do it here. I really hope you give me a chance. I strongly encourage you to check out my website. There's 5 thought pieces there and extensive information about my background, a lot of which I really haven't talked about during this interview. So I thank you for your time today, and I wish everybody safety and wellness.
Thank you. And Mr. Collins.
Thank you, Mary Beth. I've raised my family here since 1984, and both of my children were born at a Lee Health facility. And what I've recognized as a business person here in town is that if your healthcare system is healthy, then you have a healthy community. And we have a jewel here with Lee Memorial Health System. And it's been a pleasure and an honor to serve the last 8 years as a board director. There's many uncertainties that are unfolding with this pandemic, and I've proven that I can lead and innovate during this constant change. The certificate of need that got lifted last year is it's going to be a big challenge for the system as it continues to state its mission of being a safety net healthcare system and being able to compete within Lee County. As a business leader, I'll continue to push the system in delivering exceptional patient safety, quality, and compassionate care with the financial expertise to support this region's $2 billion healthcare system. Thank you.
Thank you. And Dr. Cohen.
Thank you, Mary Beth. I want to thank you acting on behalf of the League. Certainly is a great service that you're providing by having this forum. The comment that was made by somebody earlier about passion is one that I'd like to focus on. In summary, I have a great deal of passion for leadership and for healthcare and for this community that I've served for over 20 years in a variety of different capacities. But I believe that I've learned over the years to be a dispassionate leader and to be able to listen, to understand, and to interject comments which will steer conversations and debates in the direction of resolution rather than further dispute. And I've seen a number of situations where the wrong word at the wrong time is like throwing gasoline on a fire. And by all means, that's something we want to avoid. I've had the opportunity over the years to compete with other major healthcare providers for contractual relationships with municipalities to provide service to certain special populations and have been successful in getting that contract for my institution and getting along with the people afterwards who were perforce part of the system that we had organized under the contractual relationship. So I've worked again dispassionately in order to achieve my passion of serving the community broadly.
Thank you. So on behalf of the League of Women Voters of Lee County and the Alliance for the Arts, without whom these broadcasts would not happen, I want to thank each of you for the time you spent with us today and for sharing your ideas on what you would do if you were elected this term. I would like to remind voters that vote by mail ballots can be requested until October 24th to be mailed to your home, although I would suggest you do it much, much earlier. Early voting begins in Lee County on October 19th, and Election Day is November 3rd. So good luck to all of you candidates, and thanks for participating.
Thanks, Mary Beth.
Thank you, Mary Beth.
Thank you, Mary Beth. It's been a pleasure.